Hi there. My name's Dr. Samantha Slotnick, and I have a behavioral optometry practice in Scarsdale, New York. And I've been working with patients on something I refer to as lens-based postural therapy. And a lot of these patients, they are coming to me through physical therapists and movement specialists who are looking to address the patient's movement, but they realize there is something in the visual system or near the eyes that is locking them up or interfering with their ability to move freely. And they may uncover this with something as simple as comparing a movement with the eyes closed versus open, or with a frame on the patient just to see how framing the world changes things. One of my colleagues talks about using a little bit of a smear over one part of the visual field just to reduce the attention of awareness of space on one side relative to the other, and see how that changes the patient's ability to uh, process space between the two eye channels. So I wanted to share an example from one of our patients who is using this lens-based postural therapy. And so this is Joan. And Joan came to me as a referral from a physical therapist where they had identified that something about how she was taking in visual information was always at odds with her ability to come into balance in her body. So I did some exploring with her. I found a very subtle tendency. She's had some traumas. And Joan is actually 80 years old. She's an amazing woman. She's in wonderful spirits and energy, but she's been having difficulty in her body. So I'm trying lenses which are very low in power. You can tell that these prescriptions are relatively low, even if you don't know very much about lenses. The powers are sphere here, cylinder here, and the orientation of the cylinder is indicated here. And the smallest step that we generally would use is a quarter. So these are very low powered lenses. So this is a subtle prescription. This is OD is for the right eye, OS is for the left. And I'll have you just watch her here and notice that this is at axis 90. So the cylinder orientation is given by these little lines here, and that the change here that is significant is moving these lines to axis 95. So it's just this 5-degree rotation. So here you can just watch as Joan gets started walking. This is one of her first trials here. And you can see that there's a little pull to her left. And I asked her just to look before she walks, make sure she's actively looking when she walks. And you'll notice that she's pulling a little to the left, and there's a bit of torso rotation about her spine that she ends up having her left shoulder come forward and the right shoulder go back, but the reverse doesn't really happen. So with that, I made a little change to address that torso rotation here, and also that I saw maybe a pulling of her head to the right a bit. And so I used this axis to try to help. And I'm going to have you listen to first, just as soon as she put them on, she had an opinion.
Okay, and Joan said, what did Joan said?
Better.
It feels better.
Feels better.
It took pressure off your left eye.
Mm-hmm.
Good. Turn around.
You watch this
Sight the
as I
door.
start here.
Take a stroll.
And you can see how much more fluidly she's moving on this one on the right.
Feels better.
Yeah, you look a little bit more aligned.
I feel more relaxed.
Yeah, your neck looks more relaxed. One more, for good measure. One more lap. Go ahead. Your shoulder tension dropped. Uh-huh. Come on back. How's your breathing?
Good.
Comfortable.
Mm-hmm.
Okay,
I don't
plus.
have to focus on anything. Usually whatever is in trouble is alerting me and I have to focus. on whatever, if it's the neck, it's the head, the eyes, the nose, whatever.
You've got these moving little sensors going off.
Yeah, that
Uh-huh.
alarm me,
Yeah, right now you're feeling like there's no alarm. That's gorgeous.
Sure is.
Okay.
So that's Joan, who's kind enough to share with you all her experience. And when I see something that is this subtle, creating that kind of an impact on a patient's quality of life, it's very intriguing. And so I hope that this piques your interest and that gives you a little bit of a sense of how much we can do with so little. And that this is definitely a field that is not yet fully tapped in terms of its potential. Vision and how we process visual information can have a tremendous impact on patients' quality of life and their sense of their own bodies, their movement, their comfort and ease. So, thank you for sharing some time and watching and exploring with us.